We must do everything we can to ensure that patients get the health care and reproductive services that they need. And that includes protecting patients from the deceptive practices of some so-called crisis pregnancy centers, or CPCs.
We don't understand why someone is critical of people like us who are providing for the needs of people who choose life for their child.
Senator Elizabeth Warren of Massachusetts introduced the Stop Anti-Abortion Disinformation Act in July, which directs the Federal Trade Commission to prohibit advertising that dissuades patients from getting an abortion.
CPCs often lure women into their facilities by advertising themselves as comprehensive reproductive health care providers. But this is flatly untrue. Many of these CPCs are not healthcare providers, and they often operate specifically to deceive pregnant women with the goal of preventing them from having abortions.
Warren and 6 other Democratic senators sent a letter to Heartbeat International, an organization that serves more than 2,800 affiliated pregnancy centers, maternity homes, and adoption agencies worldwide. They expressed their concern about patient privacy, including the lack of HIPAA regulations for these centers, saying data could be used in abortion-related prosecutions.
We know confidentiality is important, and we will continue to serve those that give us the opportunity and trust us with that confidential information.
The president of Heartbeat International pushed back, saying the organization's operations are safe, secure, and legal.
We've been doing this for 50 plus years, and we've interacted with many, many women, even millions, I would say. And this has not been an issue that has arisen. It's really disheartening to see these Democrat senators are spending really any time really concerned with us or focusing on the pregnancy help movement, when they should really be directing their energies and efforts to find new ways to help women not need abortion.
Janet Durig has been running Capitol Hill Pregnancy Center for almost 20 years. It provides clothing, parenting classes, diapers, and more for mothers in need.
I think it's life-changing. I think it helps a mother who is socioeconomically challenged, for instance, to be able to keep a baby she really wants.
Her center was recently the target of vandalism. Security guards are now needed for the first time in 20 years.
When did keeping your baby stop being one of the choices? It's as if that's not supposed to be a choice anymore.
In response to pro-life center attacks, Republican Representatives Chris Smith and Kathy McMorris Rogers introduced the Protect Pregnancy Care Centers Act of 2022. The bill would require the Biden administration to publicly disclose how it's handling investigations and prosecutions on pregnancy center attacks.
We have sent letters to the Department of Justice, to Garland, and to Mayorkas, and to the president, asking what are they doing? How are they enforcing the law? And we got, in one case, one little paragraph says we're looking into answering your question. And frankly, what we're seeing with local and federal lack of enforcement, the pregnancy care centers, to get back to that, are just being firebombed, and people are looking into it. Well, we need results. These are very dangerous organizations, and the people behind them are committed to violence.
40 House and Senate Republicans have also sent a letter to the FBI, accusing the Bureau of misusing the Freedom of Access to Clinic Entrances Act, or FACE Act, which is designed to protect abortion clinics as well as pro-life clinics. In the letter, the members point out the recent rise of FBI investigations into pro-life protesters, but a lack of announced arrest in pregnancy center attacks. Roselle Reyes, EWTN News in Depth.
There are a lot of moving parts on Capitol Hill related to abortion and pro-life pregnancy centers. Roselle joins us now in studio. Roselle, what are you hearing from everyday Catholics on this issue?
Well, according to a recent EWTN News and Real Clear Opinion research poll, some 67% of Catholic voters support public funding for pregnancy resource centers, while 18% are opposed, and the remainder are not sure.
What about the role of Catholic Church leaders? Are Catholics generally underwhelmed by their performance on this issue?
That's a good question, Montse. We saw similar numbers when we asked about the violence against pro-life centers and if political and church leaders should be more vocal about the recent attacks and vandalism. Nearly 62% say that political and church leaders should be speaking out against the recent attacks and acts of vandalism on pregnancy resource centers, compared to 15% who say they should not, and another 23% who are not sure.
Thank you so much, Roselle. We'll continue to track the different angles of the story and see how it evolves over the coming months. We'll be right back.